Hi, this is Steve. I'm currently a radiologist. I've been practicing for about 25 years. When I was first diagnosed with a knee problem was in 1969 in high school, when I was unable to extend my knee because I had a loose fragment from osteochondritis dissecans, which is the defect in the medial compartment of the knee. And I went on until 1970s, mid 1970s, with a lot of knee pain. My meniscus had been taken out after that diagnosis in 69, and then in 1979, my first year of medical school, I knocked out my anterior cruciate. And I went on to visit with other surgeons who mostly advised me that there was very little that could be done to help me at that time. In approximately 1985, 1995, I began reading all the literature that I could regarding what was going on with knee repairs, and I was looking for definitive repairs, not for knee replacement type of procedures, because I was becoming very arthritic and I had extreme limited range of motion, about a total of 45 degrees of movement. And it was then that I discovered the articles of Dr. Stone, and I started reading about his research with the pigs and all of the things he was learning about the growth of cartilage, and primarily that they were finding that trying to put the plugs in was not working well, but he learned to do other types of procedures that I was interested in, and I came and visited with him in 2001, and he very politely but relatively definitively informed me that my knee was not eligible for the procedures at that time, and that I was going to likely result sooner than later in a knee replacement. And on that day, I actually walked down the hall and turned back around, and we had a very heart-to-heart conversation, and I essentially begged him to give it a try. And we discussed the risks of surgery and the recognition that regardless I was going to end up with a lot of surgery. And we decided to go ahead and give it a shot. And the result has been beyond what was expected. I now have cartilage and a relatively normal joint space where I had bone on bone prior to the procedure. And probably more remarkable is I convinced him to fix my anterior cruciate by using the patellar tendon, middle of the patellar tendon, at the same time that he did the Arcart, which is the repair of the cartilage, of course, and additionally we put in a meniscal allograft at the same time. At that time, he was more desirous of me doing a triple procedure, coming in and knocking off the osteophytes and then going in and fixing the anterior cruciate and then doing it as a three-step procedure. But fortunately for me, his techniques were very successful, and I went on to about 4 years without having to have anything else done. I did tear the medial meniscus early on, which was an expectation, and in 2005, 4 years later, the medial meniscus was replaced via arthroscopy. And I am now 6 years beyond that and have continued, rather than getting worse, to actually improve. For a number of years I couldn't run, and I was not really able to fully ambulate normally. I had a slight limp, but that was an incredible improvement from the very limited range of motion clear back in 2001. So in a decade, I went from being someone who was going to have a knee replacement to being someone who can now run, albeit not at a fast stride. I can jog, preferably on soft surfaces, sand, and can run 3-4 miles without any difficulty. And the goal is to keep an eye on the product that has been created in my knee and see if we can go on and improve it even more in the future. So the advice that I would give anyone is, if you want to put the effort in and you're willing to work hard at physical therapy and keeping active, the use of Pilates was advised, and that advice was taken, and it's been very beneficial. That you can literally have the opportunity to naturally rebuild your knee over a period of time, and that this, had I had a knee replacement, I would not be in the position of sitting here today advising people that if you have the time and the energy and the desire, that you can actually help to rebuild your knee by these techniques that are now available.
Awesome.
Do you want to say anything about the discipline and anything about that it is kind of a patient thing if it gets better over time? I mean, that's a lot of people ask us, when's it going to get better? And it's hard to tell them because everybody seems to be different.
Boy, Ann, that's a really good question, and I think I can do that. I just let me think about it for a minute.
I know.
Because I'm not kidding you. I mean, you know this too. I'm blanking on Lewis. You know this too, and by my talking about this for a minute, maybe before I go on tape, it'll help me to get it right.